This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health, you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program. Dave Wilson with you. Of course, Sarah Josie finishing up her advanced parental training program. There's a chance. Might have her back for next Monday's show, but we'll cross that bridge then. Joining me in studio this morning is Dr. Thomas McClellan, plastic and reconstructive surgeon over at Mon Health. Good morning.
Hey, good morning.
How you doing?
I'm great. Thank you so much for having me.
You know, there's just a chance of rain today. Just a chance of rain. Maybe we can finally get a break.
I hope so. It's supposed to. I just saw the weather. It's going to rain the next 4 days, though. Potential thunderstorms. So I don't know. Get your stuff that you need done outside.
There you go. You come in and you're literally raining on my parade here.
Yesterday I spent almost all day chopping up a tree that fell down in my front yard. So I hope the rain stays away.
All right. Well, we'll talk about weather another day. Unless you want to talk about weather. It's your segment, so we can do whatever.
I don't know much about weather.
We're going to get into reconstructive and hand surgery. That's going to be the focus here in just a little bit. But first of all, as we make all of our guests do, we want to learn a little bit more about you, where you come from, how you ended up in Morgantown. So you don't have to go all the way back to the very beginning, but a little bit of your background. Where are you from? How'd you get here?
Thank you. Well, first, I want to say hello to my son, Andrew. He's listening. Hey, Andrew. I'm originally from Charleston, West Virginia. I grew up in Charleston. I went to med school here at WVU, and then I trained outside the state at various places in plastic surgery, hand surgery, and then facial reconstruction aesthetics. I didn't think I would come back to West Virginia. I lived in big cities, but my wife's parents moved here, and it just seemed like a great place to raise a family. I enjoyed my time here in general surgery, and it was just a really natural fit.
So what drew you to the field of plastic surgery?
Plastic surgery is a great field. It's essentially three-dimensional puzzle solving. How do you fill holes from cancer? How do you rebuild something that form and function? And those are really exciting things. There's a lot of creativity in it. I'm not going to say artistic ability, but certainly puzzle solving. How do you take something that is from rob from Peter to pay Paul, so to speak?
Are there a lot of misconceptions out there about plastic surgery and what it is?
I think there is. As we've seen, pop culture, TV, Instagram, all that stuff portrays things in a certain way, and to some degree, plastic surgery is that. However, it's so much more. It is reconstructive surgery. It's pediatric surgery. The youngest person I've operated on is about 3 months old, and the oldest, I think, is 99.
Wow.
I've operated on the toe, the tip of the scalp, pretty much everywhere you want to go. And then there are varying degrees of complexity. There's microsurgery, where we sew in blood vessels under the microscope, to just removing a simple mole or a shave biopsy. So there's tremendous amounts of complexity. For example, the people that I trained with are now doing most of the face transplants in the U.S., where they're dealing with people that have been in burns or electrocuted and have severe damage to their face. So lots of complexity in a very broad field. Unfortunately, just a small percentage of it has been taken over. And I guess that's what people want to see, but there's a lot more to see.
Yeah, I think when people hear plastic, and the reason I ask that, when people hear plastic surgery, they think of all the elective surgeries that are common, but there is very much I don't want to say there's of course there's a medical application, but much more serious into that. And you mentioned some of that in just a minute, the facial transplants, cancer, burn victims, those sorts of things.
Yeah.
That you cover all of that field, including the elective stuff as well.
Yeah, it's a broad field, and they really dovetail together. You want your reconstructive surgery to be very aesthetically pleasing, and I feel that being a good reconstructive surgeon makes me a better aesthetic surgeon as well, because that's where you really get to know the anatomy, what is possible with the tissue when you enact something on it. So I feel like they both dovetail nicely together, and it's important that you do both.
All right, we're going to focus in on reconstructive and hand surgery coming up here on the other side of the break. We'll get into all of that. Dr. Thomas McClellan Joining me in studio this morning, plastic and reconstructive surgeon at Mon Health, and you're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, call now at 304-296-0041.
Dr. Thomas McClellan joining me in studio this morning, plastic and reconstructive surgeon at Mon Health. And where do you actually do the operation over at Mon Health?
Most of my operations are at the ASC, which is the Ambulatory Surgery Center at the base of the hill of Mon General, which is an amazing outpatient facility. Most of the larger surgeries I do, breast reconstruction or free flaps, are done at the main hospital. But literally, Mon General is the best hospital I've worked at for general bread and butter surgery. I've been to some big hospitals, Brigham and Women's, Duke, Emory. I feel like Mon General is just a really great place to be.
You mentioned outpatient. Are a lot of your procedures, is it in and out? And
most of them are. Probably 80% are outpatient, and we've really advanced on what we can do outpatient. I would say 10 years ago when I first started practice, I would keep more stuff in the hospital than I do now. It depends on the surgery. I do a lot of facial reconstruction after cancer. And so some of those surgeries, which generally are on older people, not with the best health profile, sometimes we need to keep them overnight, but many times it can be outpatient.
Talking to Dr. Thomas McClellan, boards, associations, do you do all that stuff in addition to your just day-to-day routine?
Yeah, so I'm board certified by the American Board of Plastic Surgery, which is the board in plastic and reconstructive surgery. And just recently, last month, I was elected the president of our state society, which is a really big honor. And I was just in D.C. Talking with Senator Manchin and Senator Capito's office about what we want to do as American Society of Plastic Surgeons, our legislative arm, which really deals with pediatric surgery, access to that, breast reconstruction, as well as improving or increasing the number of residency slots across America.
Okay, you've alluded to a couple of topics that we're going to hit on now as far as reconstructive surgery goes. Generally speaking, when we're talking about reconstructive surgery, what are we talking about?
Reconstructive surgery is making something more normal or replacing something that has been taken from, in general, cancer to back to a more normal form, providing symmetry either to the chest or the face are the two big ones that I deal with the most.
So when it comes to breast reconstructive surgery, when are patients coming to see you for that particular procedure?
I like to see people prior to their breast surgery. So there are a bunch of different types of breast surgery: a lumpectomy, radiation, or a mastectomy. My mom had breast cancer. I very much enjoy breast cancer reconstruction. And so those people generally are referred to by their general surgeon, which I think Mon General has great general surgeons. I've operated with all of them. I've done that surgery with all of them, and we have a great relationship. So those patients are then referred to me, and we talk about the reconstructive effort, and then I scrub in the same day they have their mastectomy and do their immediate breast reconstruction at the same time. So it's really a seamless process. They go to sleep and they wake up and they've already started down that reconstructive pathway.
A lot of the times the doctors come in, the surgeons, there's a new technology that's available at Mon Health. It's cutting edge. They're at the forefront of whatever advancements are taking place. Is that the case in this area as well?
Yeah, the two things I really want to highlight are a tissue expander that we use called the AlloX2, which really Mon General was the first to use in the country. And it right now it's in hundreds of hospitals across the country, and we started it here at Mon General, and that's enables us to protect the patient and potentially avoid potential future surgeries by reducing infection, reducing hematoma, and reducing seroma, which is a great advancement. The second thing which I've started using recently is the SPI-FI system. Basically, when you have a mastectomy, the skin edges can have reduced blood supply. And that can, if they don't heal correctly, a small opening can allow bacteria on the inside. And so with the SPI-FI system, we give the patient a little bit of dye, and using a special camera on a hand wand, we're able to look at that skin to see if it's viable or not. If it's not viable, we can trim the tissue edges back to viable skin, and that improves the chances of healing and improves the long-term outcome.
You know, it's amazing to me. Every week we do these shows and we talk to doctors, how far we've come, you know, not over the last 25 years, but in the last 10 years, last 5 years, how much these procedures, some of them are now outpatient where they used to be inpatient, but also making it look like nothing's ever been done.
Yeah, you know, in particular, breast reconstruction. So I was part of the first immediate allograft breast reconstruction when I was at Brigham and Women's Hospital with Carr Brewing, and that was in 2006 approximately. The way it's advanced in the last 10 years has been amazing. We now do skin-sparing mastectomies to nipple-sparing mastectomies to improved incisions to now we're doing pre-pectoral breast reconstruction, which we just started in about the past 2 years to give a really natural result with no animation when the patient moves their arms. So literally every year or two, there's a big advancement made.
Talking to Dr. Thomas McClellan, plastic and reconstructive surgeon at Mon Health, joining us in the studio this morning. What about skin cancer reconstruction? How does that factor into your practice?
It's a big part. It's something I really, really love to do. It's probably one of my favorite surgeries. So I work very closely with Mountain State Dermatology. John Hancock's, Dave Carlisle are Mohs surgeons. That's a specialized dermatologist that takes off skin cancer. And unfortunately in this area, we do have a lot of skin cancer. And so Mohs surgery is a way to take off skin cancer very selectively, where they can track the small edges of skin cancer that may exist, and it results in a higher cure rate. Sometimes you have very bad defects. So I'll see very frequently half a nose or no eyelid or a large defect in the cheek or lip. Something that may require general anesthesia or something that the dermatologists don't feel comfortable in fixing. And they send them to me, and we do multiple surgeries to repair that.
Is the goal here, whether it's the breast reconstruction, facial reconstruction, and we're going to get into hand surgery here on the other side of the break as well, just to, at the end of the day, give people that sense of normalcy back?
100%, or symmetry. You know, particularly on nose, face, etc., that can draw your eye. If you're having a conversation with someone, you're looking at something, and patients that are after cancer don't want that. They want a semblance of normalcy, a semblance, and also function. Lip and eyelid are highly functional. If you don't have a competent eyelid, your globe or your sclera can sustain a lot of damage. So it's important functionally as well.
We'll talk about hand surgery coming up on the other side of the break. Dr. Thomas McClellan joining us in the studio. We'll continue. You're listening to Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our Mon Health guests, call now 304-296-0041.
Dr. Thomas McClellan joining us in studio today, plastic and reconstructive surgeon at Mon Health. And before the break, Dr. McClellan, we were talking about hand surgery. What types of procedures are you dealing with when we start talking about hand surgeries?
Sure. It's really funny when people show up at my office and they're like, I came here to get my carpal tunnel released. What am I doing in a plastic surgeon's office? And that's a common question. And some of it is education about what we do, like we're educating people today. But I love hand surgery. It's one of my favorite things to do. I did a hand and microsurgery fellowship at Duke University. I really treat the full gamut of hand injuries and degenerative diseases. The one that I certainly would like to mention would be basilar thumb arthritis. It's really common in older women, 4 to 1 over men. There are different stages from 1 to 4. Generally, stage 3 and 4 just require surgery, where you literally remove a bone. There are a whole bunch of different ways to do it, but you can roll up a tendon to put it in there as a spacer. But one of the things that we've been doing in my office is fat injection to the basilar thumb, particularly in stage 2 and 3. That's where people are starting to feel tenderness when they put on buttons or fasten their buttons or zippers or pinch on certain items like keys. I guess people don't turn a key anymore in a car, but maybe when they turn the key to their house, they have pain with that. One of the things that we've been doing over the last year is fat grafting. So a study came out in the Journal of Plastic and Reconstructive Surgery showing that fat grafting to the basilar thumb joint actually helps improve pain and staves off that big surgery for years. So we've been doing this in my office for about the last year and a half, and we've seen really good results. I've been tracking people with DASH or disability scores, and we've had a 60% reduction in pain just with a simple fat grafting, 15-minute procedure.
In and out. That amazes me.
Yeah, we do a little fat grafting, and we splint them for 2 weeks, and we've seen a 60% improvement in their pain. And really, there's no other treatment. You can get a steroid shot, which doesn't solve any problems. It just kind of reduces inflammation, splinting, and that's it. So this is potentially a huge method to treat people with thumb pain.
Got a couple of minutes left. What other, when we're talking specifically about the hand, what other types of conditions or common conditions do you treat?
Common conditions I treat are carpal tunnel, trigger finger. Those are probably the two of the most common. Ganglion cysts, but more in-depth hand surgeries would be, I do a lot of pediatric hand surgeries, such as duplicate thumb. Maybe you're born with 2 thumbs, or you have webbed fingers out to the tip, called syndactyly. And so we solve those pediatric hand, and that's one of my favorite things to do is pediatric hand surgery. Nerve injuries, when people cut their tendons or nerves with knives or sheet metal or things like that, we repair those as well.
How often do you see pediatric patients?
More frequently than you would think, actually. Pretty much every week.
What kind of conditions are you treating with the pediatrics there?
A trigger thumb, which is common in babies, a syndactyly, a duplicate thumb, sometimes tendon injuries because children fall and injure their fingers.
Talking to Dr. Thomas McClellan, got a couple of minutes left. How much of, I won't say how much of your day is spent, but reading up, learning the new technology? You're talking about technologies that have only come out, I would guess, in the last few years. How much effort does it take to stay on the cutting edge and not just go, well, I've done this procedure for 15 years, this is the way to do it, to stay ahead and provide patients with that most progressive and most, the best way to treat whatever their issue might be?
That's a good question. So I go to 2 meetings a year. I like to go to the smaller meetings because you can really interact with the other doctors, obviously read our journal, but I like innovation. The tissue expander that I mentioned at Mon General earlier in the segment, we actually invented here in Morgantown. I just opened an engineering lab next to Mon General where we're pushing the envelope on the next technologies, such as rib fracture, things like that. So innovation and staying at the cutting edge is something that's really important to me and not hard to do because I always want to stay up with the latest.
Just about a minute left before we have to run. And just quickly, if there's a procedure like we've talked about, reconstructive, hand procedure, are we going to be referred by our general physician, our surgeon? How are we going to see you?
Generally, referrals come through the family doctors or general surgeons, but many times you can reach out directly to our office and we can help the patient work through that pathway on how to get here so that your insurance can take care of it, but generally family doctors.
The phone number, if you would like to contact Dr. McClellan, 777-4677. The website is mpsurgery.com. Appreciate you stopping by this morning. Thank you very much.
Thank you so much.
Dr. Thomas McClellan, plastic and reconstructive surgeon, our guest this morning. Again, to contact his office, 304-777-4677. mpsurgery.com is the phone number. That'll do it from On Health Talk. Coming up, Fox News, local news, and the talk of the town on the way next on WAJR.